Hello, I'm here in Gressy, a small village near Paris, and the 10th AFNET EHRA Consensus Conference is about to start. A lot has changed in the last few years, new ablation technologies, new medications that can prevent atrial fibrillation, both before it occurs the first time and after it has occurred. We've also learned that the atrial fibrillation burden plays a role for the outcomes that matter to patients: stroke, heart failure events, cardiovascular death. And we'll be here, over 80 experts from several continents of this world, and we'll be discussing these things. And I look forward to 2 days of exchange, interaction, friendly discovery, and potentially development of new ideas on how to improve the lives of patients with atrial fibrillation.
So I've been to this meeting for 3 or 4 times even, and this is one of my favorite meetings of the year. And the reason for this is that it's really a group of experts getting together in a room, coming up with new exciting ideas and then discussing them in breakout sessions. My particular subject of interest is early atrial fibrillation, early AF detection through screening.
Yeah, hello, my name is Andreas Rillig. I'm a electrophysiologist from Hamburg, from the University Heart and Vascular Center. And it's my first time to join the conference, and I'm very glad to be here and very happy to be invited. And so far, I think it's a very fruitful discussion going on with a lot of very interesting and very timely topics. So there's a lot of discussion of AF entities, of prevention of atrial fibrillation, which is a very current issue also in the guidelines, and comorbidity discussions, how to prevent and how to treat comorbidities. On the same hand, it's about AF burden, which is a very big topic regarding stroke reduction. Also the question how to do anticoagulation in patients with AF, patients treated with catheter ablation and atrial fibrillation, what to do with the oral anticoagulation afterwards, implant an occluder, yes or no. And it will be about the patient with high comorbidity burden, which is also a very interesting topic because we have much more patients with higher age in the future. There's very fruitful discussions within the sessions, but also around the sessions. There is a lot of very friendly colleagues, and there is a big exchange on the topics also between, also in talks with 2 or 3 colleagues only. So I think this is a very excellent meeting to bring the AF treatment forward.
So my name is Jason Andrade. I'm from Vancouver, Canada. This is the second time that I've been able to attend the Consensus Conference. To me, it's a very important meeting that brings together experts from all over the world. This year, we're focused on patient outcomes such as stroke and heart failure, and trying to make the link between atrial fibrillation burden and how that affects those.
Has been an absolutely wonderful meeting. I'm Dr. Janice Chu, coming from New York City, from the United States. This is actually my first time participating in the Consensus Conference. It's been a real delight sitting side by side with our international colleagues all over and being invited as an international speaker. I had a chance to bring forth some of the American perspective in terms of atrial fibrillation and its reduction. We compared this to some of the earlier talks by our European leaders here. And in our talk, we highlighted atrial fibrillation burden in the US consensus guideline in a scientific document as well as a clinical guideline document. I would emphasize that AFib burden is a dynamic process. There are also risk factors, they are dynamic, and that there is a dimension of time that's not been previously emphasized, and that there may be issues related to cumulative exposure that we need to think about in determining what's clinically meaningful in patients with atrial fibrillation.
Yes, my third time at this conference, and I'm looking forward to it every time. As still a little bit of a junior in the field, first of all, it's a privilege to be with the seniors. It's very inspiring because it's not that big a group, so it's easy to get to talk with everyone, and the discussions are inspiring. And I'm very interested in phenotyping atrial fibrillation. Moving from the past, where atrial fibrillation was either you have it or you don't, until now where it's very much more granular, and there's a lot of very nice discussions about what is atrial fibrillation and what are the different kinds of atrial fibrillation that exist, and how should we approach them in different patients. So yeah, it's good discussions, and nice to be able to discuss it in a little nerdy group.
First of all, I would like to congratulate Paulus and the entire AFNET team for another great conference. This is my fourth time that I take part in the AFNET conference, and it's always been a really stimulating time. At this day and age, we usually meet at conferences and we are bombarded with talks of results, of studies, of concepts. But this is really the one AF conference that's different in so many ways. First of all, it's a big family of top-notch researchers and physicians exchanging ideas, both in the sessions, in the breakout groups, but also in the discussions during lunches and during the breaks. Number two, we not so much present each other results of things that have already been done, but we present each other concepts. We think in new directions of AF diagnosis and therapy. And third of all, this all leads then to great breakout groups where we discuss different topics that are relevant for AFib care, for the advancement of our field, and ultimately for our patients. Especially now, this last session on AFib burden, I think is really important and helps us move from the dichotomous concept of AFib or no AFib to the new assessment of atrial fibrillation, thinking in terms of the atrial burden, just to highlight one of the many new directions that this conference is taking us in the advancement of atrial fibrillation diagnosis and care.
So, hello, I think that this meeting, the EHRA AFNET meeting, is a quite good opportunity to meet with colleagues all around the world, not only Europe. And we have discussed very interesting and timely topics, like, for example, starting with how to measure the impact of atrial fibrillation in our patients. And for ages we have been estimating this with time for the first recurrence, but now burden appears to be a more sensible or more accurate way of measuring the impact of atrial fibrillation. There are different ways to measure this, and and they have advantages and disadvantages, each of them. In addition, another important topic is discussing our knowledge that we are facing many patients, and it's unrealistic to think that all these patients will be treated with ablation. And this emphasizes the important role of antiarrhythmic drugs still nowadays, and the importance of developing new agents. Other aspects that were really interesting is some bad consequences of atrial fibrillation, like for example, cognitive decline. That is something that we as electrophysiologists should be more aware and try to explore in more comprehensive way in our patients. So different tests were analyzed and ways to implement this in our current workflow were discussed. So in general, I would say as a summary that this is a critical meeting that is conducted in a yearly basis, and give us the opportunity to network with other researchers and discuss what are the main topics that to focus our attention as clinicians, as researchers.